October 23rd, 2025. We are streaming our fourth spine surgery of the day here at Deuk Spine Institute, live over the internet, Facebook, YouTube, X, LinkedIn. And we have, of course, our host, Henry, and Dr. Deuk Majin in the operating room here with my operative team. Our patient travels here from Georgia. He has been suffering with debilitating lower back pain. It's going down both legs, but worse on the right side. He's had this pain for 30 years. I believe he was injured in the military. He's, huh? Yeah. And you can see from his MRI there are 3 discs that are damaged. He unfortunately could not afford to cover all 3 disc surgeries, so we're going to only be fixing 1 today. And it breaks my heart that he's in this situation. I wish that there was somebody out there that would help him cover the rest of the surgery for him. But I had a talk with him. He's a good man, very good man. He's here with his wife. And he told me, pick the 1 disc out of all of them that you think is going to help me the most. So I picked what I thought was the worst one, which is L45. I hope and pray that I'm right and that he gets some good relief. So we're going to get started. In the meantime, Henry is going to show you guys the 30 different causes of back pain. This patient has 3 of those 30. I'm Dr. R. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4-millimeter incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. Our patient is asleep, and we are now inside the L4-5 disc, the one that we're trying to fix. Remember, he injured 3 discs. He has symptoms at all 3. We're only operating on one of the 3 discs today. We're going to have to fix the other ones another time, hopefully soon for him. He's had horrible back pain, horrible leg pain, right greater than left, sciatic symptoms down his leg. He has 3 discs that are blown out on both sides. We're just doing 1 on one side. We need to do 6 total. We're doing 1 out of 6. That was his choice. It's all he could afford, and that's what we're doing. So it's unfortunate, but this is the reality of medicine today. We're going to do our best for this gentleman. You can see from our video, there are 30 specific things that do cause back pain. And back pain is the most common medical problem in the world. Doesn't matter where you go. Did we forget the white balance?
We get it, yes.
I'm sorry?
He's not a great camera.
I think it's the camera.
He's not, yeah, oh yeah, for sure.
Back pain affects more than 1 billion people worldwide. And today, in the year of 2025, only one place in the world can cure all of that back pain, and that's Deuk Spine Institute. Because we have discovered not just the causes of back pain, which I just showed them to you on that video, we've also discovered the cure to each cause. The only thing we don't treat is tumors and infections of the spine. We leave those for our colleagues at the university hospitals. It's where those kind of patients are best treated anyway. The rest of the pain can be treated simply with minimally invasive treatments that we have pioneered and perfected here at Deuk Spine Institute. We have patients that come from all over the world. Earlier today, a patient from New York City with neck pain. She underwent the cervical Deuk laser disc repair. The next patient was a patient who came from Chicago. And the last patient was a patient from Florida. This patient comes from Georgia. And the last patient we have is actually coming from New Hampshire. Yeah. So we have people from all over the world that come here. Oh, big herniation. Look at this. Not the biggest we've ever had. Doesn't break a record, but that's a good size right there. You see that, Henry? That's what was pinching on his nerve right there. So we're going to get some more out. We're not done. There's plenty more to come out. All right. Any questions?
At this moment, no current questions.
Let's show the audience how it is that a herniated disc can be so painful. When I say herniated disc, I'm referring to what you all know as a bulging disc, a protruded disc, an extruded disc, a ruptured disc, an extruded, slipped, degenerated disc. All of those terms are interchangeable. Essentially, we call them all disc injuries. Here's another piece. Let's put a little collection here, Louise. Don't be so stingy. Okay, so we're going to start a little collection of herniations. We're just going to put the big ones. The little ones we won't. And then we'll show them to you at the end.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
This piece of herniation I'm working on right now, we've already taken out a bunch, but this piece is so big, it literally will not fit out the tube. And it's you can see it's breaking into pieces, splintering. All right? I would love to get the whole thing out, but it is massive. And it won't fit through this tube, even though the tube is almost 6 millimeters wide. It's right here. Every time I feel like it's about to come, it breaks. It breaks off again. All right. We're going to keep working on this. There, look at that thing. You guys see it right there? It is ginormous.
Yes, we do.
I just cannot get it past the tube, but we're going to keep taking it apart a little bit at a time. And at the end, you're going to see all these pieces add up. And you can see how big the herniation is on that MRI. This is like the never-ending herniation. Any questions?
No current questions, but we do have a comment coming from, this is one of my favorite names so far, No Snow in Florida on YouTube, saying that's quite a bit of disc.
Yeah, it is a big disc herniation. But no snow in Florida. I hate to break the news. It does snow in Florida. I've seen it. I've seen it snow one day, one time in the last 30 years. But I know it snowed more than that. As a matter of fact, it snowed in Gainesville, Florida, when I was a resident there. Gainesville, Florida. So typically Florida never sees snow, that's correct, but occasionally we get a cold front from the Canadian Rockies that's so cold that even Florida gets some snow. Yeah, I'm not talking about Miami. I'm talking about North Florida, next to Georgia. And Gainesville, where I did my neurosurgery training, was north central Florida. So
It snowed in the northern panhandle earlier this year.
yeah, it snowed there this year too, I remember. Yeah, you're right. So far, everything's going good for this gentleman. Again, he injured his back how many years ago? 20 years ago? And he's been living in pain for 20 years. He is a veteran of our military in the United States. My father was a veteran in our military from the Army. I personally love our vets, our men and women who fought, and men and women who didn't fight, who supported them. So I worked in the VA hospital, or Veteran Administration Hospital. That's what VA stands for those of you who don't know. The Veterans Administration Hospital is a hospital that is funded by the Veterans Affairs budget, the VA budget, from our government in America. And basically, they're supposed to cover medical care for vets. The problem is they're severely underfunded. Our politicians vote every year to underfund the VA system, and the money is often squandered by the VA. For example, our VA system just bought the electronic medical records system. They were supposed to spend $5 billion, with a B, billion dollars on the medical records system from Cerner, C-E-R-N-E-R. Of course, Cerner, when they quoted the VA system, the $5 billion, or it was $3 or $4 billion originally, then it went up to 5. When they quoted them the $5 billion price tag, they knew very well that the VA would agree to buy this, and then they had an out in the contract that allowed them to increase the price, and they knew that the VA would need to increase the price. And last I heard, they were up at 15 and then $20 billion for the medical record system. Now remember, the problem with the VA is millions of vets go untreated every year without getting the surgery they need, the medication they need, because the VA says, we don't have the money to pay for your medical care. We don't have the money. We don't have the money, okay? We don't have the money. But then suddenly, they have $20 billion to pay for an electronic medical record system that does nothing to help the veterans, nothing. The VA system had an electronic medical record system to begin with. They had Meditech. And they did it for years without it. But when I worked at the VA back in the 90s and early 2000s, this was 25 years ago, they had a medical record system, and it was phenomenal. It was the best there was. Meditech. It did everything we needed.
Why couldn't they stay with that?
They should have stayed with that. But instead, because there's corruption among our politicians, corruption in our government.
They say that some politicians might be part owners of those.
Yeah, the politicians are owners in those medical record companies. Either they're family members or somehow they got stock options like Nancy Pelosi. You know, they're corrupt. They're all crooks. Here's another piece of herniation. So the VA, when I was there, we used to want to fix the vets right away. They would come in, I'm in so much pain. You shouldn't be in pain. We can fix this. And we would offer to do their surgery right away. And then the VA would say, no, we're not. We can't do too much surgery. Why not? Well, we don't have the budget. Somehow they didn't have the budget for medicine. They didn't have the budget for surgery. They didn't have the budget for clinic. They didn't have the budget for anything. And we were free, by the way. We worked for free. And I would be happy to continue to work for free for our vets. But unfortunately, they said we don't have the budget. And then somehow, miraculously, overnight, they had $20 billion to pay for a computer program that nobody needs and nobody wants. It's disgusting. The corruption, the filth, the dishonesty, the immorality that exists in our government and our systems today. Why? Because our politicians are so fucking corrupt, they can't help themselves. And I wish to God Trump would do something about the VA system and the healthcare system, because I can help him fix it. But nobody calls me.
Dr. Oz, the stuff they're not going to
Dr. Oz is worthless.
Yeah, he's worried about his vitamins.
Worthless piece of shit, Dr. Oz. I don't know how the hell he got his job.
Charlotte.
They're all charlatans. They're all whores. And what's his name? Kennedy. I thought he was going to do something to help our healthcare systems. No. Yeah. Instead, he's got a vendetta against the pharmaceutical industry for vaccines. Which, by the way, vaccines have saved people for years. Right, Hector? I mean, you know, the problem is Americans forget. They forget what diseases like polio looks like. I've seen polio patients where they can't walk. They just are wheelchair bound their whole life. And you talk about feeling bad for somebody with polio, you're going to feel bad for that person as long as they live, because they have no quality of life. So vaccines, some of the earlier vaccines are definitely necessary. Now, is there corruption in pharma? Of course there's corruption in pharma. But, you know, we need the right people evaluating the effectiveness of our vaccines. And I can tell you, polio vaccine, measles, mumps, rubella, tuberculosis, all those are 100% necessary. Okay?
Is it necessary to pay Travis Kelsey, a non-medicine person, $25 million to talk about?
No, the problem is when you get corruption by politicians like Fauci, who knew about this virus being created in China, who funded it, and knew that if it was released, it would create a massive hysteria and epidemic, and that people would be begging for a vaccine, and of course he facilitated all of that. That's when things go wrong with vaccines, okay? When money and corruption and greed replace honesty, integrity, morality, and the intent to help, which is the noble profession of medicine. It's been bastardized and corrupted, unfortunately. All right, here we are, almost done. I've got a little bit more to go. I've taken out so much herniation. We're going to show you in just a minute. Any questions?
Yes, we have a question and a comment. This question is from Ping on Facebook.
Ping. Yes, ping, ping. Welcome.
Saying, hi, Doc. When do you plan on retiring, and what happens to the DLDR when you do?
Well, my friend, good question. I've been doing a lot of soul searching lately, Ping. I could have retired years ago. I have the money. I don't need to say more than that, but I do. I made the money doing fusions. Back in the day when fusions, well, that's all I knew how to do, really. Before I learned how to do the laser or figured out how to do the laser. I made a lot of money doing fusions, and I'm very happy that I did, because it's given me the ability to make choices in my life. Well, should I keep working or should I retire and enjoy life? But the truth is, I've thought about retirement for a long time, and I just don't like the idea of not working. I love my work. That's the problem. I love coming to work every day. I love seeing patients. I love figuring out what's wrong with them. I love fixing them in the operating room. I just love it. But what I hate is dealing with insurance companies. I hate it. I hate the corruption in our medical system. I hate it. But the good is helping people get better. And that's why I do it. So I will die in the operating room, my friend. I will die in the operating room, or I'll die in the clinic. I'm going to die somewhere. And I just can't stay home or go traveling, go to the beach every day like Joe Biden. I just can't do it. I really love my work. So I've already decided I'm just going to keep working until I physically cannot or mentally cannot do it anymore. And then I'll stop, okay? Dr. Berndes says he feels the same way. So, to answer your question about retirement, I have no plans for it. As far as the DLDR, here's my thought. The truth is, we need your support. Your support, and everybody out there, we need your support. Because running this practice, this Deuk Spine Institute, is expensive. It's very, very expensive. 5 minutes or less. And it's expensive because we have high salaries. I have good employees, but honestly, their salaries, they don't make a lot of money for what they do, but we just have a lot of people. We have doctors I have to pay, staff I have to pay, a lot of nurses. And honestly, they're not making a killing. They're actually, I hate to say it, but they make less than they should. All of them. I wish I could pay all of them more, but I can't afford to because we don't have enough money coming in. So what's going to happen with the DLDR? I don't know. It's really up to you guys out there. If you guys support the Deuk Spine and you support what we're doing, then come, send your friends and family, send money. We need it, and we'll stay in business. If people don't value what we do, then we'll be gone after I'm done. All right, we'll be gone. And if that's the way it's going to be, then that's just the way it's going to be. There's only so much I can do. I'm not going to, I'm one person. I can't change the world by myself. I need help. But if the world doesn't value what I do and what I've discovered, then so be it. Then the world will continue to live in pain after I'm gone. I hope that's not the case. I really do. I hope that somebody will pick up the torch. I hope that we'll get support and recognition from the world for what we're doing so that people will be aware and they won't let this technology die out. It's really the technology that matters. It's the ability to diagnose the cause of back pain. It's the ability to cure it. Those two things. Thank you. The ability to diagnose, the ability to cure. They go hand in hand, by the way. You cannot cure if you don't know the diagnosis. You cannot diagnose unless you have knowledge of how to diagnose. And most doctors do not. They do not know how to diagnose the cause of back pain. They just don't, simply. And so I'm trying to teach people. I've created all these videos, all these animations, blogs, websites. I don't know what else to do. I'm trying to teach the world that we now have a cure. But we can't reach people, and we don't have a big marketing budget. We don't have billions of dollars or even millions of dollars. We have thousands of dollars, and that's it. So what's going to happen, I don't know. That's the honest answer. I hope to God that my son and daughter take over the company and that they keep doing this to help people, because I think it's the greatest, the noblest and greatest profession of all, medicine, and in particular the ability to cure back pain. If that dies with me, it would be very sad. It would be very sad to discover the cure, and then it dies because we don't have enough revenue or money to keep going. So it is what it is. I struggle every day, work hard to keep this business going. I'm the CEO, COO, CFO of the company. And it's a lot for one person to do, including doing all the surgeries and diagnosing people and managing people. So that's the truth. All right, we're just about done. You can see the back of the disc now. We're outside right here. We're in the foramen. There's no more herniation. We've gotten it all. I'm going to show you guys the herniation in a moment. Luis has been collecting it, and we've got it right here for you all to see. Okay? Did we get 100%? No. We never get 100% of the herniation. Nobody in the world can get 100%. We get as much as we can. And it turns out that that works every time. Don't ask me how, it just does. But you can see we've gotten rid of as much herniation as we can with the laser and the grabber, and I feel really good. We got the pressure off the nerve. He still has 2 more disc herniations that need to be fixed, for sure. 100% I'm sure of it. But he just couldn't afford it, so we can't do it. The reality is, I don't mind doing it. I could take the time to do it. It's just an expense issue. All right. Let's just take one more peek right here. That looks good. That's the last of it. I got 1 minute left. We're done. Any other questions?
No current questions, but we do have a comment coming from Poodle Dog on YouTube
Poodle Dog.
saying, I want to thank you from my heart for saving my life for back surgery and my neck. If it wasn't for your skills, I would have been suffering all my life. My Jesus grants you your long life full of good health. There is a special place for you in heaven.
Well, thank you so much. I appreciate that. I hope your blessing goes out to my whole team and all of our patients too. Yeah, we're done. Thank you so much. I'm going to show you guys the herniation, so don't go anywhere. All right, we just took the scope out. Remember, we did right side L4-5. I'm going to put some antibiotics because we've never had an infection in any of these surgeries that we've done, the laser surgeries. We've done over 2,700 laser surgeries here at Deuk Spine in 20 years. That's around 200. Oh, no, sorry. That's about 130 a year. These last few years, we've been hitting about 300 a year. So we've been doing a lot more. That said, never an infection. So we're very careful about keeping clean and sterility. And honestly, it's a testament to my team, not me. I just do my thing, but my team is amazing. They do a great job of sterilizing all the equipment. Take a look, folks. Look at this thing. Ooh, so much herniation. Look at that.
You see it?
Yeah, there's the ruler right there. And look at all these pieces. So just imagine all these were clumped up together, right? Pushing on the nerve. Here's another big one right there. Just all these pieces just pushing on the nerve. One disc herniation right there. But all the pieces make up one herniation, crushing his nerve. He's still going to have some leg symptoms because we couldn't do the other two discs we needed to. But hopefully he can come back in the future if somebody agrees to pay for it. And we can fix the rest. My God, look at the incision, folks. Look at that. Right? You can see a little blood coming up. It's tiny, tiny, tiny incision. He's going to heal up so quick, and I hope this really fixes at least the majority of his problems. Thanks for joining us. We have one more surgery left. The next surgery is a gentleman who actually had the Deuk laser disc repair done and re-herniated. So 1 out of 100 of our patients do re-herniate. They go out and do something, to re-herniate. I won't say what he did. I don't really know for sure what he did, but he called me and said, last 3 weeks I've been having back and increasing leg pain on my side, my left side, and we got an MRI, and sure enough, he re-herniated. So we're going to do a redo DLDR on the next patient, and we're going to do a few extra things. His facets are bothering him too, so we're going to do his facets, right? Facets and the DLDR. And we're going to try to do a second disc that we couldn't get to last time. We'll see what happens. All right, thanks for joining us, but we got one more to go. Our audience with a nice video comparing the DLDR to other treatments.
Of course.
Hi, I'm Dr. Deuk Machen. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called the posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain, and that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world.